Hi, I'm Chelsea Rainwater. I'm the Deputy Executive Director of No Overdose Baton Rouge. We are a community based grassroots organization that provides harm reduction services to the Baton Rouge area. What is harm reduction? As its name suggests, it involves reducing negative consequences associated with drug use and other high risk behaviors. In our case, we focus predominantly on opioid use. My colleague and I had both had people close to us who had passed away due to opioid overdose, and we saw a need in the community and we tried to fill it. At No Overdose Baton Rouge, we have a two-pronged approach. We provide a medication called naloxone, which is a life-saving drug. It is actually an antidote to opioid overdose. So if someone is overdosing on an opioid and someone else administers naloxone on them, it can potentially save their life. Our other approach is through syringe services. We provide clean, sterile syringes to people who are using drugs to prevent the spread of bloodborne pathogens such as HIV and hepatitis C. Baton Rouge has been one of the leading metropolitan statistical areas for estimated HIV cases for quite some time. That's why this is so important. But recognizing overdose is important, and that's what I want to talk to you about today. The symptoms of an opioid overdose are different from the symptoms of an overdose on uppers. Opioid overdose involves cyanosis, where the lips turn blue, slow, labored breathing, a slow pulse. The person may be unconscious or unresponsive. If you see this happening, you need to call 911 immediately. Our participants say that there are factors that deter them from calling 911, particularly previous charges, warrants, and fear that the cops will come and find the drugs and everybody will be in trouble. However, it's critical that you call emergency medical services because after administering naloxone, the person can actually go back into overdose after 20 to 30 minutes when the drug wears off. So after calling 911, you need to begin rescue breathing. You're going to tilt the chin and head back, open the mouth, check the airway for blockage, and administer one breath every 5 to 7 seconds. If this still is not working and the person is still unconscious and unresponsive, that's when you want to prepare to use the naloxone, also called Narcan. It comes in different forms, including a nasal injector, which you would just squirt up the nose, an auto injector, which you just push into one of the muscles, or a vial including intramuscular syringes where you'll draw it up and inject it. Apart from the nasal Narcan, the auto injector, and the IM syringe vial situation, you're going to want to go into a muscle in the arm, thigh, or buttocks. You can go through the clothes. Don't worry about that. One dose is 1 milliliter. So when you draw it up with the syringe, if you have a vial, we have single serve vials. So one vial is 1 milliliter. So you'll just get everything in there. Don't worry about being particular and administer it to the person. There is a cap on where naloxone stops working, but it has no negative side effects. You can't overdose on it. You can't get high on it. It can't hurt you. If you're not overdosing on opioids and someone gives you naloxone, you will be okay. That's why this is such a great medication and such an asset to our community and other communities around the U.S. who are seeing such a high rise in the number of overdose deaths. After administering the naloxone, you need to stay around till the ambulance comes or until the person is, I would wait about 3 to 4 hours until the person is okay after the overdose. I would hide their drugs if there is any more. The person who has overdosed often doesn't know what has gone on. They have no recollection of overdosing. All they know is that they feel sick and they want to get high again. So that's why that last step is important. We want to get naloxone into the hands of anyone who may be anywhere where someone might overdose. And overdoses can happen anywhere. Please call our hotline number. Visit us at facebook.com/noodbr for more information. Thank you so much for your time.